do take those codes, it will not be repeated again. And whoever missed any of the codes will not be shared and will not be shared in the chat. So please make sure you are focused during the whole session. Now, the tricky part is this is an online. We can't see you whether you're in or out of the session or you're focused with us. That's why we have this very strict rules regarding the CEU passcodes. The CEU passcodes will be shared in the beginning, mid, and the end of our CEU event today. I would like to thank the ABA Journal Club and in collaboration with Sharifa Yateem Consulting, which is an approved CEU provider. We are doing this for the community in order for us to be able to learn through research. And we, as ABA Journal Club, we are, as volunteers, we're all volunteers based that are running this program, and even the moderators that are running this, that are reviewing articles for us and making it simple and sharing it with everyone to ensure we are applying it in our practices. They're also volunteers. So I want to thank every single person that trusts the ABA Journal Club vision and the community support that we are giving. We don't get paid and we don't pay anyone for this. So we are doing this for the community to ensure we continue to build our clinical experiences and our knowledge. So I want to thank everyone. MashaAllah, we have 41 participants today. The ABA Journal Club.
They're gonna be.
Yeah, 42. So we have, mashallah, a very big number.
Yes.
And we are very happy to hear that we are seeing people from around the world connected to the ABA Journal Club community. We are very proud of that. This means that ABA Journal Club is doing well, alhamdulillah, and we've been up and running for the past 4 years now, and we will continue. Inshallah, our next one will be in September. So every 3 months, we will have a free CEU. So remember, keep an ears on for your passcodes. And then what you will do with those passcodes, we will share a link, an evaluation link. That an evaluation link will be sent by our admin, Ms. Rowena. She will send the evaluation link to ensure that you press on the link, create the evaluation, fill in the evaluation, and then we will you will share those passcodes, and then you will get that certification. Please do not ask me for the passcodes. If you missed it, you missed it. Khalas. And hopefully the information will be reinforcing enough for you to attend to the end of the program. So without any delaying, I would like to share that Ms. Rowena has just sent the article in the chat and also the slides, and she will be also sending the link for the evaluation. So before we start, I want to, Mr. Ihab, welcome to the ABA Journal Club, and please introduce yourself and let us know where you're at in the world, what do you do, and how did you get into the ABA world?
Love it, lovely story, Dr. Sharifa. First of all, this is Ihab Moses talking to you, but at the beginning, I would like to thank this lady, Dr. Sharifa Yateem. Really, I love your contributions. I love your commitment. I love your support. That when you see some in our world, someone, even you don't know him or her, you are gonna say, "Mashallah, Arab world is in the field of applied behavior analysis to serve and advocate for." And I really like these words, Dr. Sharifa, and I know that you agree with me, and also the attendees. The word serve and advocate. Yes, we serve these children. We advocate for them. I think I'm a soldier. I need to defend of my clients or children or students as much as I can. So my pleasure, my appreciation, my gratitude to your efforts, you and your team. I think you are doing amazing. We are gonna disseminate a proper application of ABA in the Arab world with your efforts and contributions. So please, from my heart, go ahead, I love to support as much as I can. Even when I received your message, it was very, very heartful and lovely for me to say yes, sure, we are here to be under this group, which is lovely ABA Journal Club. So thank you so much, and I love it.
Thank you so much.
Okay.
It gives me positive reinforcement. I need that. Thank you. Yes, please go ahead with give me your education background and where do you work, and then you can start sharing your slides.
This is Ihab Musa. I'm gonna tell you. I studied in Egypt. I lived in Egypt. I'm Egyptian, but I went to Kuwait to 2014. I worked as a special ed classroom teacher in one of the private schools in Kuwait, which caring about students with special educational needs. I worked with the student with different disabilities of ASD and other developmental disabilities. Our school is serving students from 6 years old till 21 years old. So I worked with early intervention students and adults. But my lovely is the people and children with some scratch, hit, challenging behaviors. This is lovely. This is what I love to work with. I started my life in ABA, which I loved a lot. In 2020, okay, I started to study 40 hours as RPT through Autism Partnership. I loved it with Dr. Johnston Leaf and their way and their commitment to disseminate ABE and to really understand why the student is screaming, why he does not get this much progress. So when you are doing work, Dr. Sharifa, in classroom of 6 to 8 students with educational or special ed background, and you drive in special needs, and you go through ABA strategies, this is lovely. You understand when he's gonna get up from his seat and go through the window or come to his peer or come to you as a teacher. This is what I loved through ABE. After that, Dr. Sharifa, I started my BCBA coursework in University of California, Santa Barbara. Okay, and it was during Corona. I did my best to hit this exam, but unfortunately it went out of my hand with I got 394, so 6 points. I think 2 questions. And the story is, I'm in Kuwait, okay? There is no institute to do the exam, so I have to travel to Abu Dhabi. Okay, so I came twice, and the degree, it's the same. 392, 394, and it was like November, December, bye-bye EHAB. The board said US, UK, Canada, and Australia. So I went to QABA board fast, and I started to do the equivalence. I finished, as you know, during the BCBA coursework, you finished all the study, you finished all the supervision hours, just I submit, I paid, I did the exam, and I started my life in the field as a qualified behavior analyst. At this point, I got granted in my school to shift from a classroom teacher to behavior analyst in Khalifa School, who was gonna design and do whatever related to the field of behavior analysis. Also, I got the approval from the QABA board to do courses like ABAT, QASB, and QABA through ABC of Behavior platform. So this is my short story. I was in Kuwait, so during Eid, I came now in Egypt, so I'm in Egypt right now for Eid Eid holiday, and it was lovely that we are gonna do it after Eid. So I'm happy to be with you. I'm happy to be with this group of people. They are around 86, which is lovely for me. This is my honor and my pleasure to share some of information with the group through ABE journal. So thank you for this wonderful opportunity. This is my story.
Thank you.
You
I
have
love
Musa
your
at the end.
story. It's very inspiring. And I love that you did not give up in your certifications to get it. And I'm so inspired. Keep doing it. And hopefully, we will get to learn from your article. So, I just wanted to inform everyone that there were around 60 people on the waiting list. We can only accept up to 99 people because of the Zoom limitation. So we're not able to add more. But unfortunately, we are needing to stop to add more people. Khalas, we have to stop it because now we're going to start the discussion. We already gave a good 10 minutes for people to join. So let's, without any further ado, let's start with the presentation. And I will just go through the first one if Mr. Ihab, you can help me. So the presentation title that we chose is Comparing the Effect of Echoic and Listener Responding in the Development of Complex Intraverbals. And the author, which I was so proud, by Nof Ezrayer, she published in the Behavior Analysis in Practice in 2024. And when I was reading her background, she is in collaboration with a university in Saudi Arabia. So hopefully we'll get the author, inshallah, to present at the ABA Journal Club one day.
Inshallah.
Inshallah. Moving to the next slide, Mr. Yahab. So here we already spoke about that. So in our journal club, we try to make it as consistently as possible. We did a little bit of introduction on the ABA Journal Club, and the way we summarize the article, Mr. Ihab will summarize the introduction that was in the article, and then we'll talk about the methodology, then the settings, results, and the discussions. So we'll go to the next slide. So we can skip that. We already did that. You can skip it. And the journal club information, you can email us, the ABA Journal Club. And Ms. Rowena, if you can share us the links and information about how to join, or let your friends know about the ABA Journal Club. And we'd like to also go to the next slide, slide 7. We were in collaboration with the Emirates College of Advanced Education. They were supporting us to get the CEU, but now that the master course for ABA was shut down, so now it is transferred, the ABA Journal Club with the Sharifa Yateem Consulting to provide those free CEUs for the community. Next. We have an Instagram account, ABA Journal Club, and then now number 9 is Mr. Ihab's. But before you start, Mr. Ihab, our first code, guys, the first code. Are you awake with us? The first code, guys.
Motivation, Dr. Sharifa.
Yes, the first code. Ya Jama'a, the first code. Wait, let me remember this. I wrote it down somewhere. Just give me one second. Yeah. So the first code is echoic. Echoic, because part of our article today will be speaking about echoic as a verbal operant and what it means. Mr. Ihab will explain what echoic is. And don't write it in the chat, please. Echoic, E-C-H-O-I-C, echoic. Okay, I'll just give you a few more seconds. Echoic is our first code of the day. Echoic. All right. Echo. Now, let's go, Mr. Ihab. You got the mic.
Yeah, here we go. Okay. This is lovely article, and I'm gonna go through the title first, which is comparing the effects of echoic and listener responding in the development of complex introverbals. Why this article? Why we choose this article? Because we are in the field, and the part of verbal behavior is very vital part for us as specialists, supervisors, therapists, and parents as well. I'm going to give a brief statement about the study. This study investigates the comparative effectiveness of echoic prompting versus listener responding strategies in facilitating complex intraverbal responses among children with autism spectrum disorder. Okay, when you come to teaching verbal behavior to a student with ASD, you are gonna throw echoic. You're gonna go through listener responding. You're gonna go through intraverbal. We have 6 elementary verbal operands. Skinner talked about them long time ago, but my focus here is either echoic or listener responding strategies is more effective to facilitate intraverbal responses. When you teach intraverbal, which is complex, and Dr. Sharifa, we need to take care of complex intraverbal. Here, Dr. Noof comes to complex. She didn't mention only intraverbal, which is, what is your name? Sharifa. That's good. Nice, I like it, lovely. But she goes for complex intraverbal. For example, if you have a group of friends and I'm gonna ask you, who is your friend wearing black shirt? So it is not only a simple intraverbal with one simple conditional discrimination, but complex intraverbal comes under 2 antecedent stimuli. You need to identify, you need to recognize your friends, and you need to identify who is wearing black shirt. Then you are gonna give the response, and the response doesn't have point-to-point correspondence. It doesn't have the same beginning, middle, and end with the verbal SD. So this study is very important because it focuses on examining the effectiveness of echoic and listener responding prompt in the emergence of complex intraverbals. Also, its purpose to measure differences in mastery, efficiency, and generalization. How echoic strategies and listener responding strategies affect in teaching the intraverbal responses. And also, this is very good. I'm going to send it to your team, Dr. Sharifa, this Word file. This Word file is easy one. I'm going to talk about it, but later on, and it gives you very good insight based on the article as well. I'm going to share it with you. So here, if we go through echoic, what does it mean, echoic? What does it mean?
Can everyone answer in the chat?
Yep, they can answer in the chat. This is
what
very
does
lovely.
echoic mean? So we probably are all behavior analysts or technicians or assistant behavior analysts. What does echoic mean? And what did you learn about echoics? That's a good question. We want to test your, we refresh your information and the vocabulary of verbal operands. Repeating the same word, imitation.
Very good.
Repeating same words. I heard vocal imitation, verbal imitation. It's very important also to mention it's a point-to-point imitation, right?
Yep.
So it means imitating or repeating a sound, repeat same sound or same word, imitates the sound or word. So we're getting the same answers here. Representing a sound by imitation. Point-to-point correspondence. Yes, Mu'taz. This is what you're using behavior, a verbal behavior vocab. Type of verbal behavior where a person repeats or imitates the sound or word spoken by another person.
And also the formal similarity. So if I go through Echoic in easy way, Echoic is just put in mind, duplicate the same with point-to-point correspondence, which is same beginning, middle, and end. You start, I start, you stop, I stop, and with the same formal similarity. I said car, you said car. Sharifa, you said Sharifa. This is echoic. So let's go to intraverbal. Give an example, or what is intraverbal with example? Simple example.
Yalla guys, what is intraverbal? And give us some examples of intraverbals that we use every day in our life.
They are very active, Dr. Sharif.
I'm proud of our community.
Yeah.
Yes, active community. How are you? I'm fine. What's your name? My name is Martez. Response to questions, talking way one-to-one, getting in some information, responding to answer a question, replying to a conversation or a question.
The wheels on the bus go.
Yeah, responding to greetings, filling in.
Yep. 2 plus 2 equals.
How was your day? Fill in the blank. Engage in a conversation. Intraverbal is a verbal response that are controlled by other stimuli without one-to-one correspondence. Go, Van. Are you enjoying the lecture? Yes. A person responds to a verbal stimulus with a related but different verbal response. Round and round. I like this song, by the way. Yes, Mohammed, me too. I love it. Interverbals is formal similarity, not point-to-point. Conversation. Do you like IBA club? For sure.
Iman, yeah, for sure.
Communication dialogue, no point-to-point similarity. Answering WH questions and filling ins. Okay, we got most of the.
I think they hit it, Dr. Sharifa. They did it very nicely. I love it.
Absolutely.
So if we go back to this slide, intraverbals, when you are going to teach your client or your child intraverbals are core key for conversation and academic success. You teach him to respond to his name. You want him to be involved in social situations and respond when someone asks him, what is your name? Children with ASD often struggle with complex intraverbals, and this is true. Most of children with autism, they have some difficulties in intraverbals, especially when they are gonna answer questions. This study compares, and we are gonna confirm again, this study is to compare two teaching methods, echoic versus listener responding strategies and their effectiveness to develop a complex intraverbal. Intraverbal behavior refers to response controlled by verbal stimuli without point-to-point correspondence, no P2P, which is critical for language development and meaningful social interaction. As I said, and as you know from your experience, most of our children, they have deficits in this area, especially when verbal conditional discrimination is required. So when it is simple, when it is easy, they can answer it. For example, if you said, what is your name? He's going to give you his name or her name. But when you make it complex, what do you wear on your head? He or she needs to go and identify, recognize her head and recognize what they are putting on their head, then answer you. So intraverbals is very complex skill. So if we go through key concepts, I think we covered this point, intraverbal responding verbally to verbal stimulus, with no point-to-point correspondence. Echoic repeating words, phrases, listener responding, selecting stimuli after hearing a prompt, or following directions and instructions. Complex intraverbals, which is our article main point. Complex intraverbal requires conditional discrimination, as response is reinforced when it comes under stimulus control and the response is under the presence of another stimulus control. For example, what do you wear in your head? So complex intraverbals requires conditional discrimination. Conditional discrimination, you have one stimulus, an additional or another stimulus. So it is not easy for our children with ASD. The complexity of intraverbal behavior can range from simple format that requires simple discrimination, the wheels on the bus go, and we understand the child will fill in the blank, ready, steady, and 1 + 1 equal, to advance it. So when you start with simple, which needs simple discrimination, you go for the advanced one, which require verbal conditional discrimination. For example, what do you wear in your head, or what is above a house? You need to see the building, which is a house, and what is above this house. So intraverbal, we can say simple intraverbal, simple conditional discrimination, complex intraverbal, conditional verbal discrimination. Okay, for listener responding, can we get an example for listener responding, if you don't mind, our attendees?
Listener responding, guys.
Yep.
Listener responding.
Guys, go ahead.
Go ahead, guys. Show us what you know. What is listener responding? It shows following instructions. So you listen something and then you respond. Get the chair, and the child goes and gets the chair, for example. Clap your hands, and then the child will start to clap his hands. Answers, replied. Follow instructions and discrimination between the instructions. Touching your nose, so understanding the body parts.
Yep.
Responding after an instruction is given. Receptive language. Following instructions, does the child will do it or not? Respond to instructions or to his name. Follow instructions after me. Tacting. Someone said tacting. SD given, expecting responses. Asked to point to a cat, and the child points to a cat attacked.
Okay, so if thank you so much for your lovely examples and answers. I like it much. For LR listener responding, it comes under following instructions or directions, which is receptive language, and you are going to reinforce the proper listening and following instructions. You told him, open the door, he opened the door, you said, you're amazing. So he listened, he understand, he followed and performed what you asked for. So this is simple listener responding. The article participant. For the participant, this part we are gonna move. Okay, here we have 4 children. This article show it 4 children with ASD. Their ages between 5 to 7 years old. I think this is the most of our children and students needs our support more. Even it's better before this age. I understand most of you, and Dr. Sharifa as well will agree, when you get a student or a child 5 years or 6 years old and most of his adaptive basic skills are showing deficits or big deficits, your answer, your commitment in the field, your feeling is, why I didn't know you 3-4 years before. So I grab you, I work with you, we get and acquire more skills and abilities that is lost. And as you know, most of our children, they need the support, especially in the field of verbal behavior in the early intervention age, which is the golden skill age. So all of these four children, they are receiving 24 to 35 hours per week of ABA services. VBMAP scores range from 133 to 149, level 3 skill, and these, this is their language and cognitive levels were assessed using VBMAP. Okay, so we have 4 children, 3 boys and 1 girl. Their ages between 5 to 7 years old, and they are getting 24 to 35 hours per week of ABE services. And I think now, Dr. Sharifa, in this number, some they think it's a lot, but in reality it isn't. Our children, they need more services, they need more support. As much as they get services and sessions, they are gonna progress. Okay, if I go to setting and material. Setting and material session conducted at ABA clinic or ABA center. 2 sets of complex intraverbal questions per participant. Each student get, or each child get 2 sets of intraverbal questions customized based on their learning plan. So based on the plan, they got the training to see the effects of echoic and listener responding strategies to build and to improve complex intraverbals. Okay, if I go through methodology and design, each participant received training in both conditions. Both conditions means here we have 2 conditions. You know, experimental design. Experimental design is lovely in the field of ABA. So I hope everyone understands it. So we have 2 conditions. We have echoic and we have listener responding, and we see their effect and the development of complex intraverbal. In both conditions, using individualized stimulator to their treatment goals. Data collection focused on emergence of unprompted complex intraverbal responses in post-test condition. So how we are gonna make it plus, how we are gonna make it correct response when it is unprompted, which is independent response. When the child give an independent response, this is correct response for the study. Here we go through the design. The design they used non-concurrent multiple probe design across participant combined with alternating treatment design, which is lovely. And I understand why they use alternating treatment design here to give quick comparative between the 2 strategies. If you study experimental design, when you are gonna to do quick comparison between 2 interventions or 2 conditions, alternating treatment design is gonna show you which one has effect with the participant or with the conditions. Was used to evaluate relative effectiveness of 2 intervention conditions. Echoic to intraverbal training. And at this point, I'm gonna explain a little here and go through the Word file. The child repeated a prompted verbal stimulus, say hot drinks, before being asked related intraverbal questions, which is, what are some hot drinks? So here in echoic as you understand, we said hot drinks. Before we go to the question itself, what are some hot drinks? And when you go to it, focus, because this is going to show the results. Listener responding to intraverbal training. The child repeated prompt verbal stimulus. The child was asked to identify or select relevant visual stimulus based. What is the hint here? Let's see, Dr. Sharifa, our attendees are focused, awake, or what? Let's see here what happened. Because this is going to affect the result. You are going to understand it when you are going to work with your student and intraverbal training. You are going to hear focus on what? Echoic or listener respond. Let me see the hint in the chat.
So
okay.
Can I ask you, what was the question again? Just to clarify for everyone.
Okay, to make it clear for everyone, here is in echoic to intraverbal training, there is a key, there is a hint here, which is help to develop intraverbals.
Yeah.
If you see both of these two lines, you focus here, echoic, the child repeated verbal stimulus, and intraverbal is verbal as well. We need them to verbalize it. But here for listener responding, and this will be shown in the results, the child asked to identify or select which is visual more stimulus.
So pointing, so he's pointing to the picture. So there are two different types of training here. Echoic to intraverbal, so he will use the verbal echoic in order to answer the question, what are some hot drinks? And then the listener responding is to point to the drink when asked, what are some hot drinks?
And here for the echoic, this is give the advantage when you are gonna improve intraverbal or complex intraverbal responses with your clients. Echoic training is more effective based on the echoic prompt or verbal prompt itself. Okay, so if I go to this lovely file, okay, echoic and listener responding, they are very important in language development. It's okay. Listener responding, focus on understanding, following instruction. It's fine. But here we go. This is the most important. Echoic responding. It's allowed, Dr. Sharifa, yeah?
Yes, sure. Whatever makes it easier for the participants to understand the concept.
That's. Okay. Echoic responding, role of intraverbal development. So I need to develop intraverbal skills with my clients through echoic responding or echoic strategy. Echoic training gives a powerful tool for establishing intraverbal responses, especially when paired with other techniques like tag training. The example is the most effective one. If a child learns to say dog, when they hear dog, it's echoic. You, as therapist, as specialist, said dog, the child repeated after you, dog. It's echoic and it's verbal. It's verbal. Then learns to say dog when they see picture of dog. It's tagged. This can lead to the intraverbal skill of saying dog when asked, what do you see? So here is the point. I am as specialist or trainer, I train my child to say dog. When I said dog, first I said dog, then he or she said dog, which is echoic. This is more effective and can lead to intraverbal skill, intraverbal response. Why? Because you are gonna ask him or her, what do you see, or which animal is it? And he needs to say dog, which is heard by him before. Okay, the effectiveness of echoic training to develop intraverbals. Research suggests that echoic to intraverbal training can be very effective in promoting emergence of complex intraverbals. Here, I'm gonna ask an answer, and if someone like to answer in the chat, it's fine. Why echoic promote complex intraverbals? Why echoic help the children to give and improve more complex intraverbals? The answer is here because at the beginning, you as a specialist used verbal prompt, which is the verbal pronunciation or the word itself, and he heard it. He hear you, and when you go to intraverbal, you are gonna ask, so it's easy for him or her. Listener responding, and here is comparison between them. Listener
Sorry, Mr.
responding,
Ihab, there's someone that said, can you repeat what you just said regarding the effectiveness of the echoic to intraverbal training?
yep, sure. I came here to this part. Echoic to intraverbal can be very effective in promoting emergence of complex intraverbals. Okay, why? If I ask myself why echoic is effective to improve complex intraverbal, the answer is here. And this is what we do with our kids. You, as a therapist, use it with him, which is the echoic self and verbal stimulus, which you are teaching the student dog. Okay, how through echoic training, how he's going to do it? Therapist or specialist said dog, the child repeats after him or her by saying dog. So when it comes after the training completed, when it comes to the intraverbal, you ask the student, what do you see? And there is a picture of dog, he will say dog. Or which animal is it? He's going to say dog. Because of the verbal stimulus that happened at the beginning. Okay. Okay. Here we go. Listener responding. The role of listener responding in intraverbal development. Listener responding skill can contribute in the development of intraverbals. For sure, we understand. But here, please, I'm gonna double confirm. This is the third time of the title of our article today. Article is what? Compare. Both of them has effectiveness. Both of them echoic responding or listener responding strategies, they have impact, but we are gonna give a comparison, which one is more effective to develop complex intraverbals. So listener responding skills can contribute to the development of intraverbals by building foundation of receptive language, which is very important part when we train our children that are necessary for understanding and responding to verbal stimulus. How that child is going to respond you if he or she does not understand you. This is the most important. How the child is going to answer and give you the correct response if he is not attended to you and the materials. So our focus in any ABA programs for the pre-attending skills, the student should be attended to the materials, to you, and compliance, how he's sitting, how he's going to follow the instructions, how he interact with instructions and you, and the other environmental stimuli and the environment or the setting itself. So, for example, if a child can follow instruction, point to an apple, listener responding, we did it, point to apple. I think this is one of your examples. They are developing skills that can be used in intraverbal interactions by answering the questions, what do you eat? And here, as we go back to the slide, this is the same. Here is visual stimulus, but here it was verbal. Verbal stimulus helps to improve intraverbal skills. Visual stimulus helps as well, but the verbal one is more effective. So, indirect impact, how listener responding indirectly impact intraverbal skills. Listener responding skills directly relate to understanding and following instructions. They can indirectly support intraverbals development by expanding learners or the child overall language repertoire and the ability to process verbal information. So, from this explanation, I think we both understand that based on our study of today, Echoic gives more advantage when you teach your students complex intraverbal skills. The comparison. Would you like to go back to the slides or here it's fine, Dr. Sharifa? It's allowed, yeah?
Yeah, it's fine. Absolutely.
Okay. Here is a little comparison, direct and indirect. So Echoic gives a direct impact in development of intraverbals. Echoic training, when you train the child through Echoic to intraverbals to teach complex intraverbals and improve it towards your child achieving the targets and goals, Echoic can do that. Echoic training can be more directly linked to development of intraverbals, especially when combined with other strategies like TACT. So the direct effect, the direct impact to develop intraverbals through Echoic training. Indirect, listener responding. Listener responding gives effectiveness, yes, but in such way indirect. For example, here, listener responding may have more indirect influence on intraverbal development by building foundation of receptive language. Here we get back again to listener responding and receptive language. He understands, he answers, but here it was verbal. Here it was verbal. You train on verbal, which gives advantage. Both of them are important, but if we come, which one is more effective, which one give the direct impact on intraverbal development, it's Echoic training. Effectiveness studies has shown that Echoic to intraverbal training be more effective in promoting emergence of complex intraverbal in some cases. So here in the combination, I will go back to the slides. Okay. Here we go, the procedures. Let's focus again on the slides, please. So I'm gonna complete, but before okay, go ahead, Dr. Sharif.
So the second passcode for today, for your CEU certifications is verbal behavior.
Wow.
Verbal behavior. As you guys know that we are focusing today on verbal behavior. So our second code is called verbal behavior. Verbal behavior, guys. Verbal behavior is one of the research based under the applied behavior analysis that focuses on language skills. So verbal behavior is the second code. Remember it, write it down, verbal behavior. I will not repeat it. Please focus, verbal behavior. Okay, thank you. You can go ahead, Mr. Ihab.
Okay, thank you so much. Okay, please, can you give an example in the chat about complex intraverbal? Provide an example of complex intraverbal in the chat. We have, I think, half minute. Dr. Sharifa, someone is asking, what was the first? What was the first? I think what was the first code?
So if someone can give us an example of complex intraverbals, I think many people, it's the first time for them to hear complex intraverbals. Maybe a lot of people would hear the word intraverbals, but complex interverbals, maybe this is the article we got to learn what complex interverbals mean. So I would think that it is giving us more elaborative answers. So the question that they would ask, they need that elaborative answers. So if anyone can give us an examples, when the child expresses his feelings or express what he is seeing in the picture, or what are some things that you can eat, for example, or what are some animals that have fur, or what's inside your bag, is something that could be an intraverbal. Or maybe we can say, tell me about what you did today, right? That could be something. Or our normal day conversations could be very complex intraverbals. When a child is asked, what do you do when you're asleep, when you're sleepy? And they respond, I go to bed, go brush my teeth, blah, blah, blah. So, talking about the routines of the day is something that we can consider as complex intraverbals. Thank you guys for sharing.
Okay, thank you so much. Lovely answers and lovely examples. Okay, procedures and measurement training and prop sessions were conducted in one-on-one format using tabletop setup. Here, the sessions as regular sessions as ABA program is done. Correct responses. Correct responses require the child to vocally identify at least 3 appropriate items within 5 seconds of the prompt. So here we go. When the supervisor, if we have some of the attendees are supervisors and therapists or behavior technicians, when the supervisor write it, please, in the plan, please take care of it. 3 appropriate items, it means 3 appropriate items. Within 5 seconds, it has to be 5 seconds because the development or update of the programs and performance based on the data. So we are in the field of ABA, we are data-driven, data decision-making, everything through what is written. Don't explain me about what happened, but show me what happened. Responses had to be unprompted and non-repetitive to count as correct. So should I here give a prompt? Then I count it as plus, it's recorded. Here, this is very critical part. Again and again, data and what is written, and we need to follow treatment integrity and procedural fidelity. Do it or implement it as written. So here we are going to focus on the point of data and what is written we have to adhere to. So responses here should be independently to be counted as correct. I think this part we are gonna go through procedural fidelity and inter-observer agreement were ensured through trained observers. with treatment integrity, scores average of 95%, and IOA scores consistent near 100. So in this study, they are going to double confirm on the procedural fidelity, which comes under treatment integrity, which is very, very important aspect in the field of applied behavior analysis. Serves everything should be done as written, should be based on data. So if I go here, this is a screenshot from the article itself, and we have our participant, John, Sarah, Jacob, and Eden, and each sit under the two conditions, which is echoic and listener responding. Here, under echoic condition, what they did, and here under listener responding, for example, let's go to John. Question 1, what are some hot drinks? As we said, coffee, tea, hot chocolate. Okay, what are some cold drinks? Milkshake, juice, soda. For listener responding, what are some sweet food? Chocolate candy, donuts. What are some salty foods? Crackers, popcorn, spaghetti. Okay, so here is under each condition, they are gonna show us what are the questions that comes for echoic or listener responding. Okay, results. And with the results, I'm gonna show you this graph. This graph, Dr. Sharifa, I created as bar graph to be simple for our attendees to show them the results. From the graph, as I know, ABA specialists, they love graph much. Here, if you go up, echoic in blue, listener responding in red, okay? So what is an effect? For sure, you are gonna say, based on this graph, echoic is more effective on the training of complex intraverbal. Okay, being back to the article slides, for John, showed emergence under both echoic and listener responding. So for one of the children, echoic and listener responding was both effective for him. And based on individual differences. Here it is. Echoic and listener responding strategies, they have the same effect to improve John intraverbal responses. But for Jacob and Eden, what happened here? Echoic training has more effectiveness to develop complex intraverbal responses. So for John, based on the study, John under echoic and listener responding conditions, he gives very good intraverbal responses. Jacob and Eden emerge only under echoic conditions. So echoic is more effective here. What comes in your head as behavior analyst or specialist in the field of ABA when you see this and this? If you are gonna imagine it or build your skills around your kids, or imagine my client, he's like John or like Jacob or Eden. Please, each one has individual differences, and based on the learning history and prerequisites. This is very important part. Don't skip. Each one of them has his own learning effects and experiences, so it affects the training itself. Okay. For Sarah didn't show emergence in either conditions. require direct intraverbal training. So if you are training your kids, imagine that both of them, if you combine echoic and listener responding training prompts, strategies to improve complex intraverbals, it will be very effective. On the other side, echoic training and strategies itself or alone can be more effective. It can. Listener responding can do some part of development of complex intraverbal responses. It can, but here, based on this article, echoic was effective than listener responding strategies. For Sarah, here she doesn't achieve much of the progress, but still echoic gives more effectiveness. Okay, analysis and interpretation. Echoic training more effective for 3 out of 4 participants. So please, my lovely behavior analyst and technician in the field, when you teach complex intraverbals, you know what you are going to focus on. Per your echoic repertoire influences its success. Keep in mind, learning history and speaker still play key role in the acquisition. So you need, yeah, I hear your first, yeah, each student is different. We understand, but here, based on the article, echoic gives good hand to improve intraverbals, which is complex intraverbals, but here also take care of your echoic repertoire. It will influence your child performance, and here also the history of learning and the skills or prerequisites plays a good role in the acquisition itself. Okay, limitations. It's okay. Let's talk about it, Dr. Sharifa, or okay. Limitations here, no generalization data collected. Similar item across condition maybe have impacted results with small sample size. These are some limitations, and I hope that Dr. Sharif, inshallah, is gonna dive in and do more researches on this part. So we are lucky to have more research based. So we are happy. Okay, recommendations. But before we go to recommendations, I'm gonna go back here to my lovely board. I know, Dr. Sharifa, it's 6:30 but 7:30, but 5 minutes. Okay. Combination many effective interventions. Combine both echoic and listener responding strategies with other techniques like TACT to develop comprehensive or complex intraverbal responses. In summary, both echoic and listener responding are important, but echoic appears more direct, immediate impact on the emergence of intraverbal response. Back to the slides. Okay, article summary recommendations include both echoic and listener responding. So we are in the field when we train our students. Please keep in mind echoic and listener responding. Echoic is more effective. Prioritize training to match the child's existing strength. Monitor emergence and generalization. And generalization and maintenance are very, very important skills, Dr. Sharifa, we need. Believe me, after summer holiday, I come back to my students and I cry a lot. Okay. Discussions, echoic prompts may better support verbal stimulus control. That's why we said echoic training gives more and direct and immediate impact on teaching complex intraverbals in its development. Echoic here may be better support verbal stimulus control, especially when aligned with child existing repertoire. Listener responding may offer limited practice in vocal production. This is the answer of what you asked, or this is extra answer. Hence less effectiveness for introverts. Teaching both speaker and listener skills concurrently is crucial. Okay, the choice of prompting should be tailored to individual learners' profiles. Okay, similarly, I think we have one. Okay, echo to intraverbal more effective for most children. This study, this is true and based on the graph as well. Here, professionals who are you should assess prompt types and reinforce verbal behavior development. Future studies by Dr. Sharifa, inshallah, should examine generalization at larger sample. Okay, we are at the end, so
Thank
it's
you, Mr. Ihab. It was
my
really,
pleasure and my
really,
honor.
really how you simplified the study. I am really, really surprised because it's such a complex information to digest. So thank you so much. For everyone that are in a rush to go to their next meetings or to go have dinner, the third passcode is Skinner. Everyone should know Skinner. Skinner is the father of verbal behavior.
Yes.
So Skinner is the third passcode. So make sure we memorize his name. If you don't know who's Skinner, please Google him so that you can understand who is Skinner. So Skinner is a very popular personnel in behavior analysis. This is your third passcode, Skinner. Skinner, Skinner, Skinner. Thank you, Mr. Ihab, again. And Ms. Rowena just sent a message of the evaluation form link. So please do press on the evaluation form link right now so you can put your passcodes immediately. Whoever missed the first and second passcode, unfortunately, we cannot repeat them as instructed in the beginning of the lecture. I really want to thank Mr. Ihab for your time and volunteering to summarize this article. It's such a lovely article, and I learned a lot by myself. You know, it's very interesting to know that there is the listening responding to interverbal training,
Right.
actually, because I'm always used to, and I've always been used to getting echoic to interverbal as part of our practices, but maybe I need to try the listening responding to another child. Maybe it works best for them. So why not? And it's nice to see that other students in this case study, we had some cases where their intraverbals did progress with the listener responding technique. So it's very
Yes.
lovely to hear that. And again, I want to thank Mr. Ihab from the bottom of my heart to really accept this invitation and be part of the community. And inshallah, we'll see him again and again in the next time. Our next, inshallah, our next CEU ABA Journal Club article review will be in September. So we won't have one until September. I'll miss you all, guys. And again, welcome to the ABA Journal Club. I hope everyone really benefited from this initiative, this volunteer-based community initiative for the ABA community in the region and inshallah around the world. And please have a wonderful night and good night. Thank you.
Thank you so much, Dr. Sharifa. Thank you so much.